Thanks everybody for joining us this morning. We're excited to have folks in attendance and imagine we'll get a few more joining late. My name is Sarah Kurz. I'm the Vice President of Communications and Outreach for Rose Community Foundation, and I'm just going to share a few quick housekeeping items before we get started. So for attendees who are joining us this morning, you can only see the panelists and some Rose Community Foundation staff on the screen right now. But we're really excited to have dozens of folks joining us today. Although we can't gather in person, we're grateful to our panelists and our attendees for taking this time to be together and learn together from a distance. I think it's going to be a really good conversation this morning. A few things about Zoom, which we're all pretty intimately familiar with by now. We've set this up as a webinar, so please note that we've disabled the chat function, so you may still see chat messages from me or from the panelists, but you as an attendee will not be able to put messages there that everybody can see. So we would love to get questions from the audience today and would ask that you use the Q&A tab on your screen, which is just to the left of the chat button. So we'll pose some questions to the panelists to start the call, and then later on we'll open it up for questions, but you can submit them at any point and we'll just start gathering them so we have them when we open that up. We've put everybody on mute, so the only way that we'll be able to get your questions is through the Q&A function. And if for any reason you have trouble using it, you can email info at rcfdenver.org and submit questions that way. Also, you may see a button on your screen that says raise hand. But we as administrators and panelists can't see when you do that. So just ignore that button, or if you do, just know that we won't be able to see it. So again, please use the Q&A function to submit questions. So we'll get started right away, and I'm excited to introduce Lindy Eichenbaum Lent first. She's President and CEO of Rose Community Foundation for some opening remarks.
Thank you, Sarah. Good morning, everyone.
Morning.
It's wonderful. It's wonderful to see people, even if it's through a computer screen. We really hope that all of you and your families are doing well during these challenging times, and we so appreciate you being with us today. We're really excited to see the level of interest from our donors and our fund holders, our Legacy Circle members, our partners, and foundation leadership past and present. Rose Community Foundation is particularly grateful to today's panelists, who are all busy doing incredibly vital work to support our region at this critical moment, and who have generously taken the time to be with us this morning. We're very much looking forward to you hearing from them. But before we get to that, I wanted to share some perspective from the foundation. First and foremost, COVID-19 cast into stark relief the fault lines in America's systems, highlighting and exacerbating the consequences of centuries of racist policies and practices. While this moment has broadened attention to these issues, for many, including our panelists today, the work for better and more just systems began long before 2020. Each of our panelists work within and around systems that often fail to serve communities of color. Those systems we will hear specifically about today are education, healthcare, criminal justice, and workforce development. Each of these leaders and their organizations are working to create better and more racially just systems. Before we hear from the panel, a little context about the foundation's work at this moment and how it has led us to this conversation. In April of this year, recognizing the enormous pressures of COVID-19 on our region and the reality that the pandemic's health and economic effects are disparately impacting communities of color, older adults, and those furthest from opportunity, Rose Community Foundation committed the bulk of our 2020 grant-making resources toward COVID, toward rapid response, impact mitigation, and long-term recovery, all through an equity lens, both in the greater Denver Jewish community and within the Jewish community. Since then, we have deployed over $7 million to respond to this crisis locally. And yet, COVID-19 is not the only virus threatening our country. Racism in all of its forms endangers people's safety, security, and damages the fabric of our community. We recognize the privilege and power that comes with being a foundation, and we committed before recent events with the unveiling of our new strategic plan in January of 2020 to listening, learning, and directing our philanthropy going forward toward advancing equity, justice, and inclusion. To that end, we're expanding relationships with organizations on the front lines of racial justice work in our community. We're exploring the regional policy and advocacy landscape on racial justice issues to find opportunities where the foundation can meaningfully engage. Several racial justice organizations received grants in our recent COVID-19 impact mitigation cycle, and we look forward to partnering with more organizations in the future. We are also exploring ways to bolster the work that is happening or could happen at the intersection between the Jewish community and racial justice issues. Last week, our team visited with Janice Mackey from YASFA, Young Aspiring Americans for Social and Political Activism, and she described coronavirus and racism as compounding pandemics. That language really resonated with us as we prepared for today's webinar in thinking about how the two issues intersect, how they magnify the negative impacts of each other, and how they potentially inspire us not to get back to normal, but to build a new and better normal for all. I know many in our audience and on our staff have read scholar and author Ibram X. Kendi's book, How to Be an Anti-Racist. Or maybe you watched the recent online interview with him hosted by Denver's Meisel Museum. In April, Dr. Kendi wrote a piece in The Atlantic where he described, quote, the racial pandemic within the viral pandemic, meaning the ways in which COVID-19 has disproportionately impacted communities of color, both in terms of getting the virus and dying from it. The deep-seated systemic racism underlying this data is just one of many examples of a system or systems that continually fail the communities they seek to serve. And yet there's hope. There are community-driven solutions to these broken systems. There are models to support, to learn from, and to replicate. So to learn more about some of these incredibly creative and effective approaches in our own community, I'd like to introduce Benilda Samuels, Rose Community Foundation's Vice President of Programs, who will introduce and facilitate the panel discussion. Thank you very much.
Thank you, Lindy, and welcome everyone. I am so pleased to be joined today by our four panelists. As Lindy said, each one of them offers a very creative and community-driven solution to challenges within the system they work in. Education, the economy, health. Some actually work in several systems at a time. Each organization joining us today is either a current grantee or has received a grant from Rose Community Foundation. We have invested in their work because we believe in supporting organizations and leaders who are closest to the challenges they are solving. We asked them to speak to you today because we are inspired by their work. We believe we all have much to learn from their perspectives, from their experiences, and from their leadership. You know, to be authentic and effective, solutions often need to include and empower communities that they're intending to serve. And I think this is something that is very particularly unique about this group of leaders. Sometimes we call that grassroots work. And by grassroots, we mean leaders and organizations that are working on alleviating a social issue from the ground up. They're using not only their lived experiences, but their knowledge, their deep knowledge of community, their education, their professional experience, and their careers to solve these social issues. which some systems have really struggled to solve. So I think it'll be a great conversation. You know, we wanted to share this group perspective and their solutions and their approaches with you because they're very unique. They're different than what the system offers. Each one of them has actually had to build a solution outside of the system in order to make things work for communities. And so these 4 panelists know their communities. They often, often panelists who are often community leaders who are working closest to community come from those communities, have experienced issues personally, and structure their work to be constantly informed and led by the communities they serve, which is a really unique place for community leaders to be, and what makes their work so effective. So I wanted to introduce all 4 of them, but I actually think that I'm going to let them do a little bit of introduction of themselves because people do that best. So I'm going to ask each of the panelists to introduce yourselves, your name, your organization, and please tell us a little bit about your mission, the work that you do, why does your organization exist, and what brought you to this work, and what is the work? Because some of us in the audience may be new to your organization. So I'm going to start with Sade. You're on the left of me.
Good morning, everyone. And first and foremost, thank you for inviting me to be a part of this, important and critical conversation around communities of color. So as I said, my name is Sade Cooper. I am the Executive Director and co-founder of CHIC, which is Collaborative Healing Initiative within Communities. CHIC was an organization that was formed to assist women of color. We are here strictly because there are systems that have been failing women of color, whether that's in education, workforce, community, and reentry work. And so that's what CHIC is formed for. We like to say that it is the untold story of many women and young ladies across this nation, but CHIC is the solution. So we work in the education realm where we assist kids from K through 12 around their social, emotional, cultural well-being. We assist with workforce development where we have an emphasis of getting women into the trades. So we do a lot of hands-on training. Community, because we come for community. It's about how does CHIC bring resources back to underserved communities, right? We should all be able to enjoy the same luxuries as other communities. And then lastly is reentry. We do high levels of mentorship for young ladies who are involved in the juvenile justice system. And we do that because there aren't many people that are helping women or young ladies who are involved in the juvenile justice system in that way. And so that's a little bit about my organization on the forefront. We are really here to empower women across the board and their families and their children and their community.
Thank you. Deidre.
Well, again, as Sade said, thank you so much for having me here today. The beautiful thing about it is even though I'm with the Center for African American Health, health involves everything that Sade had talked about, that the other panelists had talked about. And so I will have my 5th anniversary in December, leading the Center for African American Health. We have been around actually for 23 years, and our mission is the health and well-being of the African American community. We also, 2 years ago, became a family resource center. So while years ago we were focused just on health narrowly defined, we define health as, do you have access to food? Do you have a safe place to live? Do you need help with job readiness? And so we're slowly growing into a one-stop. This January, we moved into our own building, and our goal is to really become a hub so that all families can come to us. And if it's not a program we're offering, we can help them navigate to wherever they need to be, whether it's health specific, mental health specific. And I have to admit, I come to this work. Ultimately, I think I was raised to do it. You know, I've had a lot of opportunity throughout the years, but at the end of the day, the Center for African American Health exists because racism exists. And I had a father who was very clear, you and your sister have great opportunities, and you're raised with expectations. And as a society, most white children are raised with expectations, but Black children are raised with hope. And no matter what you do in life, make sure you're about the business of turning hope into expectation for our kids. And so I think when I look back, that's always been that voice in my head to help me make decisions about where I want to use my time and talent. And I also am glad that I've been at the center, because the transformative work we've done with our business model, when COVID hit, it was shocking, but we were so able to pivot in many ways that I can talk about later.
Thank you, Deidre. Wisdom, shall we go to you?
Excuse me, did you say Hassan?
Wisdom.
Oh, excuse me. Okay, thank you. Sorry.
With Wakanda background.
Wakanda forever. Good morning. My name is Wisdom Amouzou, and I work at a little place called Empowered Community High School, which is in Aurora, Colorado. We're going into year 2. Our vision is "The World is Ours." It was written by a student named Jay Carter. And our mission is authentic education that is led by students, guided by educators, and co-created with community. Why I do this work? One, especially these days, honestly, I regret choosing a field with where we're all paid so poorly, especially because I work with really talented geniuses who should be making $400K a year. But what calls us to this work is always the passion for impact. In our specific case, at least my specific case, I was originally born in Togo. So I have the gift of not being born. I do call it, it's a gift to not be born into this country if you inherit a Black body. Because from birth, I was wisdom first. And then when we immigrated to America, you quickly begin to understand basically the inner workings of white supremacy. And all of a sudden, yeah, I became Black. And that has a specific identity, that has a specific access to power, especially in this country. And I grew up in Aurora, Colorado, which is a refugee repopulation zone, for those who don't know. And that's where I went to middle school, high school. And there's a reason the school is grounded there. For me, I used to tell, oh yeah, even during the district interview, I said I was coming back with a vengeance, because I have a deep understanding of what educational inequity does to a family, what it does to a community, what it did to my friends, who has access to a well, holistic life today, who does not. So I'm coming back with a vengeance. And we will build an institution, we're calling it our Wakanda in Aurora, an institution where not only Black bodies, but all sorts of bodies are free of colonial violence, and our children can actually achieve and unleash their full genius and potential. And then one day, and make $500K a year. So I'm gonna put that into the universe too.
I love it. Thank you, Wisdom. Hassan.
Yes, and I'm sorry to step on your toes there at the beginning, brother. First of all, good morning, and thank you for even inviting me to be a part of this distinguished panel. And Second Chance Center, my name is Hassan Latif, excuse me, and I'm executive director of Second Chance Center. And we're a reentry organization based in Aurora, Colorado, but serving the entire Denver metropolitan area. And we were blessed to be one of the grantees of the foundation. And it was unsolicited kind of support that we really appreciated in its timeliness and its thoughtfulness. So thank you. How did I get into this work? I did 18 years of incarceration here in the state of Colorado. I was released on January 4th, 2006. And even though I had family here, my wife in particular, and a place to call home when I was eventually allowed to actually go from a program that I was released to and return home, I still was met with a number of challenges, being a 50-year-old Black man just released from incarceration after 18 years. I mean, the world was entirely different in many regards coming out. And even though I had that support system, it was still a very challenging kind of a transition for me. And I was blessed early on in 2008 to get a job in a reentry organization. And what I saw was people having access to support and training and other sorts of transition assistance, and they were still cycling in and out of prison. And I would hear almost weekly people say to me, "Hey, Hassan, everything was going great. You know, I was making $20 an hour. I had my own place. I was back with my kids." And then like the bottom fell out. Well, I knew that it wasn't really happening like that. That kind of thing was the result of the erosion of discipline and the establishment of barriers that people had difficulty navigating. What bothered me, other than that, was the recidivism rate was about 50%. And the people that I worked for, well, the Department of Corrections expected it, and the people I worked for seemed to accept it. And that was a problem for me. At that point, I didn't feel the confidence that one would need to go to their supervisors or their employer and say, "Hey, I think you need to be doing it this way." Many of the clients that we serve have that same kind of lack of confidence, or however you want to describe it, that would make them able to articulate their desire to move up or to ask for a raise or a different position, that kind of thing. I was feeling those same kinds of that same sort of inequity. So here's the thing. At some point, I decided to stop being afraid. And if I thought that there's a better way to go about it, that I should just, go and do that. And so in 2012, I founded Second Chance Center. For the first year, was just a mobile unit in my car, begging my way into halfway houses. I was an addictions counselor by trade and still am, just begging my way in prisons that I used to live in. And that was in 2012. And now we're a staff of 26. And 13 of whom are formerly incarcerated persons. And basically, I loved what Wisdom had to say about education and what Deidre and Sade started out with, because we have a very simple formula that we work at Second Chance Center. Thoughts plus feelings equals behavior. It's our way of approaching the cognitive restructuring that we think is necessary for people's lives to transition successfully. That's our mission statement: helping formerly incarcerated persons transition to lives of success and fulfillment. And so we feel like if people aren't able to really come to grips and understand how they got to think like they do, what are the things that were involved in the development of our thought processes, which we've talked about a couple of them already. If we don't really take a look at how we feel about the world and our place in it, ourselves, that the likelihood of behavior change is minimized. I mean, people can be disciplined enough to get out of prison, to get out of a halfway house, to get off of parole. But if those two factors aren't addressed, we think significant behavior change is not sustainable. And that's the bulk of our work. So it's not just about getting people jobs. It's not just about navigating the challenges of finding housing, not just affordable, but available housing for folks coming out of prison, but really addressing the kind of core things that people can and have the power to make some changes in and some improvements in. And that's our own thought processes and our own ability to process feelings and thereby have that guide our behaviors and our choices. So that's our bulk of our work. So I'm open to whatever. I don't want to keep going, but thank you.
Thank you so much. Well, great. Thank you to all of you. This is giving us a taste of what this conversation is going to be all about. I'm gonna start asking some specific questions so that we can get into dialogue with one another around these issues. I mean, each one of you has built an organization in a space where there is a system that's supposed to be taking care of this, and somehow the system is not. And it's failing some people more than it's failing others. It's failing Black, Indigenous people of color more than it's failing others. So you felt the need to jump over the system, come out of the system, and build something. And some of you are the actual founders and the actual visionaries of these solutions to support your community in a unique and different way than what the system was offering. Let's talk about, like, why did you have to do that? What is the system missing that you understand so differently that you're bringing into the work? I think the uniqueness of your understanding that you bring to the work is something that could be very much of interest. So let's talk about why did you have to do that? Why did you have to step out and take on some of what the system is supposed to be doing? And how do you do that uniquely you? Let's start with wisdom.
For me, one of the things that, especially the American public education system, is most lacking is a sense of intimacy. And that's not by accident. We all know that. Well, some know, some don't. It's by design. And as I said, Empower, what we're trying to do is infuse a sense of intimacy back into the public sphere, into a public institution. And especially in the year 2020, the education, the white man who trembles in fear at the sight of a Black person running in his neighborhood, the education system failed him deeply. And yeah, I always think it's really important to step back and actually realize that when you really break down how we've defined success, that actually white children are being failed tremendously. And any kind of system that graduates folks who cannot actually operate in the increasingly globalized, multicultural world, a system that measures success by 1 or 2 test scores at the end of the day, versus the full holistic truth that is a human being. And lastly, I always do this, otherwise I'll go on the soapbox. I'll really keep my answers to 3 minutes. The last bit is just, if you actually talk to families, which is what we did for 2 years, if you just talk to families and talk to students and you ask them, what do you care about? What do you want for the future? What stands in the way? When you're 30, what kind of life do you want to live? When you're 40, when you're 50? And then you backwards map from that, you really begin to understand the many ways in which we're failing our kids beyond just reading and math in this country, in this city specifically. And for us, if we could, if our economic systems were not broken, we would actually have started a private school, but we can't. So we started something that would give us enough freedom and autonomy to actually implement the vision that our community wanted, and that is a public charter school, which is why we went that path. And I always framed it pretty clearly, which is for us, it is I wouldn't even say covert takeover of resources. Takeover is not even the right word, because we asked and they granted the charter. So it wasn't a takeover, but by year 5, our community has access to a $5 million budget to design the educational experiences that will lead to the kind of individuals who embody that statement, the world is ours. I think I answered your question. So
Yes, you did. Thank you. Thank you. I like the idea of the vision of the community. What was the vision of the community? So Sade, let's go to you. Why did you have to do this, and what is it that you are, how is it that you are approaching this work that is bringing solutions to the challenges?
Yeah, well, let me give you guys a little bit of, you know, a backdrop of my story as a young woman growing up in America, so that you can understand the system. So by the age of 6, I remember being homeless in a car, living across the street in an abandoned office building across from East, and not understanding why my mom was struggling. I just didn't understand. And how could we be struggling in a system, right, where there's all these supports, and why our children have to go through that. Fast forward, the greatest gift she could have done was said, I'm going to send you to your grandparents to give you a thriving opportunity. Come back. I come back for high school thinking things had changed. Support system has gotten better for a woman in a thriving community. No. My father has been incarcerated for 20 years, so he's never been a part of my life. Instead, as a youth, I was left in a house without running water for 3 weeks at a time, me and my brother, no food, because my mom was strung out on drugs. And not understanding how is a child in a thriving community not getting the resources that she needs, or how is her mother struggling. Keep going, had a baby at a young age, thought I was going to drop out of high school. Didn't do that because it was a mentor who changed the trajectory of my life and said, you will not, you will go to school, you will get your education, you're going to get a degree. And then I jumped into finance. And so God makes no mistakes, and I worked there for 12 years. And so imagine in a Black neighborhood, I worked in a bank, the inequities that I've seen from an economic lens of how resources are given, whether that is lending opportunities, I see redlining. So it came to me like, wow, these are systems that are controlling access, exposure, right, and opportunity, right? And I've seen this through the trajectory of my whole life, whether that be in supports or resources given to my mother, my community that's around me, when we look at those who are on, you know, TANF or low income assistance. And so it started to dawn on me, it's the systems that are the problem and how we are allocating the resources. And it took for me to be a woman and see that. And so I took a step and said, what are the things that affected me in my community? And we did we had a group that came together and said, these were some of the issues. And it just cultivated into, these are the areas that impact women. And what we do know, I can tell you as a woman being in this system, so we don't talk about, is when you're looking to change communities and families, invest in the woman. Science shows that. Science shows that. And so when you start, and I'll give you a peer example, we talk about gang violence, and we provide supports for those who are doing the violence, but we're not providing supports for those when that person comes home to change the mindsets, right? So we're only providing a Band-Aid and not the solution. And so for us, science says, invest in the woman, you invest in her family, and you invest in her communities. And that is when change starts to come. And for us, it's how do we economically lift a woman who has multiple barriers, whether that is from re-entry, whether that is, I just don't know what I don't know, right? Meaning that if I've only ever known my mother, my grandmother to be on a system that is keeping us oppressed, that's all that I know. And so working with women who are wanting to change the mindset. And so for that, I took a leap of faith and said, I want to be a solution for my community and for women of color, and created CHIC. And so 4 years later, we are here, and there's a lot of work to do. And now being a woman in part of the creation, the visionary, and those biases and those, inequities that I see on the forefront of trying to be able to provide for my community, because the systems that they keep investing into are not helping my community. So it is a double whammy. But that is why CHIC is here, to really, it's not give a handout, but a hand up to women, and to really, integrate and create access, exposure, and opportunity.
Thank you very much. Yes, I think we're hearing a theme, right? There is a vantage point for leaders, for community leaders, in that they're so proximate to the actual issues. They have lived it in some respects. And so imagine the incredible creativity that can come from someone who has lived that experience. And yes, we also need data, and we also need, academia, and we also, but this is a unique perspective that is actually creating change, and that comes with a vantage point, for sure. So I want to go to Deidre and hear about your work, because you were not the founder of the Center for African American Health, but you, I think, were the second CEO, correct? And so, and the center has completely changed its vision, its priorities, and really supporting this community in now different ways than it did before.
Correct. So when I took over in 2015, we still had a long history of serving the community. We were primarily working on health education, health promotion for seniors. So diabetes self-management, blood pressure, cancer prevention, cancer screenings. And the board's goal was, knowing that Grant Jones wanted to retire, what can we do earlier in the life course? And I had been in philanthropy primarily in the early childhood arena, and really welcomed the opportunity when they invited me to apply. And since then, and a couple of people, I must admit, have told me, wow, Deidre, it's been less than 5 years and all this stuff has happened. But I really see it as us being truly responsive, because we can't program our way out of this. So we're bumping up, we're growing our policy involvement. We're looking at the whole family, because regardless, like Sade said, regardless of what you want to do for a child, if you don't take that 2-generation approach, or in our cases, oftentimes 3-generation, it's, you're just squandering your efforts. And so now, as a family resource center, and we really adopted that model because it came with wonderful tools, because I am not interested in rebuilding wheels. And now a family comes to us, in addition to whatever class or other program or screening, we can sit with them. Our navigators can do an assessment. Okay, here's where you are now. What do you need to get to the next phase in like 6 months? And help them come up with a plan to get there. When it comes to systems, the reality, racism is in the groundwater of America. These systems weren't built for us. I was raised by an entrepreneur who actually uniquely, I think, raised my sister and I from a very young age. It's confusing when it's too early. These systems aren't designed for us, so you always have to find your way, focus on navigating. And that's really kind of what I've always done. Unless I've been in the nonprofit sector, I've always been an entrepreneur, because my father early on had a computer, back when they had the mainframes and the tapes. So I actually learned to key punch when I was 8, playing with those things. But it taught me not to look for validation or pathways in standard ways. And now with everything happening, it's been very interesting. Folks have said I've been kind of entrepreneurial with the center, but I think my strong point comes from the fact that my first health job, so to speak, was at a foundation. I knew nothing about health systems, but I had an MBA. And so I approached things from that perspective. And I've always been raised to think of things in terms of systems. What I really like about this newest generation, I shouldn't say newest because I'm raising them, but it really isn't a story of how do we navigate these systems that don't see us. It's a story of we need to change these systems, and here's how we need to change them. Along the data piece, I was frustrated for years because whenever you asked for information about certain groups of color, you'd be told, oh, you know, that data's insufficient, or let's use some census data and make some assumptions. But we deserve more than secondhand data. And so I remember meeting with my predecessor, and he had said in 2011, we had done a survey of Black churches and had 2,000 respondents, which sounded pretty impressive. I was more impressed when I talked to the health department to find out that the most the state gets typically is maybe 200 people. And that told me it's about who's asking the question, especially in a community that rightfully has distrust of a system that's always either not seen us or tried to do us harm. And so one of the very first things we started in 2016 was called Be Heard Mile High. We got help from Be Heard Philly. And we are actually the only community health panel in the nation that's in a CBO and not a university. But we have our own survey system, and once a month we'll send out topical data. And right now we have about 1,300 people in the panel. And the beauty of that and the goal of that was, you want to know what people think? We can help you find out because we can ask them very quickly and reflect that back. And I think as simple as that is, it's amazing how that's not seen as a solution. So very proud of that program. We actually were able this year to get some dollars from Robert Wood Johnson to grow it into Be Heard Colorado and to build an African-American infrastructure so that there are more advocates, regardless of topic, coming up. Because at this point, everybody knows you've got to focus on the social determinants of health, because that's just one piece of the puzzle. And I'm of the belief, so because we've existed, and for me, it's twofold. We offer programs, but we also try to work with systems because, you know, we're in this treacherous spot where they don't see us, but we need them. We need their help. And so when you think of the health system, we have excess death across the board, whether it's infant mortality, maternal mortality, diabetes, HIV, you name it. I always say it's almost a rule of three. You take the disease, we probably have it 3 times as worse, if not more. For maternal mortality, it's 4 times. If you live in New York, it's 12 times. And so how can we do systemic things to help close the gap? And I'm very excited to say we're getting ready to partner with HICPUF to look at data and take it kind of disparity by disparity. Some solutions, for instance, have been, I think it's the state of Wisconsin. Until we get things figured out with regard to bias in the medical system, they're going to treat every Black woman as a high-risk pregnancy. That way you're going to get the supports you would need in any case. And so if we can start doing that until we can kind of close these gaps, but it's definitely a long haul. But I tell you one thing, if we're at the point, we've been at the point for a decade where we can drill down and map out disparities by the zip code. And it's time to be about the action of changing it versus just watching it happen. And that's what we're trying to do. And I've already been brainstorming. I haven't met Wisdom before, but I'm going to be in contact with him. This is the second discussion I've had with Sade. I'm going to be chatting with her because we can do anything we do without huge partnerships and just seeing what community needs and community wants.
Yeah. Thank you. Yes, I completely agree. And I'm seeing the dots already. Wisdom talked about intimacy, and you talk about how you provide services in a very intimate way and in a very personal way to the people that come to the center. And so, yeah. Hassan, you've talked to us a little bit, but tell us more about your approach to complementing, you know, where the system is and what the system does.
Well, you know, I've been asked previously, you know, what brought me to this work, and sitting here listening to my fellow panelists, it's like got me thinking about things differently in this space right now. Clearly, when I hear people talk about the criminal legal system being broken, I don't agree. I think it's operating exactly as it was designed. I see it as a diabolically ingenious business plan on the one hand, and the extension of white supremacist infrastructure on the other. I mean, you go from slavery to Jim Crow to redlining to whatever. This is just different iterations of the same thing by my way of thinking. But answering the question now, I think it goes even further back to why I'm doing this work. I think I was bred actually to do this work. I remember, I'm raised from New York, so I spent my early years in New York. And I remember back in the early 60s, they started to build a complex in our neighborhood. It was the first sign of gentrification, if you wanna reach back that far to it. And I'm dating myself purposely. But they were building this complex for 25,000 people coming into our neighborhood. And they also started building a precinct, a police precinct. And even as a child of 8 or 9 years old, I knew that this was being built for me. And my friends and I would do everything we could to break into this particular site and steal whatever wasn't locked down, whether it was a big spool of wire or a 50-pound bag of cement that we had to haul off together, not to sell, but to hide in an effort to try to keep this building from going up. It didn't work. They kept bringing new supplies. So we went to another phase and we started hiding files and saw blades inside of vents because it was clear to us that this was being built for us, and eventually we would deal with it. Now, I don't know if that's what we're talking about this morning, but I think the psychological impacts of systems on children's thinking, because I did start out telling you guys about thoughts plus feelings equals behavior. That's an unfortunate mindset for a child to be developing. There's a Kenyan proverb that says the child is the father of the man, and subsequently the mother of the woman. And by this, the meaning is really simple, is that whatever we're exposed to or nurtured by as children leads to the development of who we are as human beings. So that's not an excuse for why people choose to do the kind of things they do, and in particular perpetrating crimes against other human beings. And it doesn't say that someone is locked into a certain path because of that nurturing or that environment. But I started using at age 5. And when people ask, well, how does a 5-year-old start using? It's clear, with the help of adults. You know, so when you ask how I got to this work, I think my family put me on the course to do this work, and my neighborhood and the school system in New York and all those kinds of things. So I find myself now where people are attributing some sort of visionary genius to me of sorts, and they don't really understand my walk. I've just been trying to stay out of the way and not mess up any of the blessings and try to manage opportunities as best I can. I got into this work because there was no space that was being occupied by people who were directly impacted by the criminal legal system. And I remember when I was driving around in my car with work boots and used clothes in my trunk and information of resources to hand out to people I saw at bus stops. I heard that there was a community reentry meeting going on at 940 Broadway, which is the headquarters of the Division of Adult Parole, and some of the administrators of the Colorado Department of Corrections. And I had not been invited to it, of course. But I went to this building where parolees go on a regular, and I went through it as though I was a parolee. And I went through the metal detector, and I had them search my property. But instead of going right, I went left. And I went to this floor where the meeting was being held, and I looked in, and I walked into the meeting, and I asked if this was a community reentry meeting. They said yes. And I said, well, I don't see any representatives from the community, so I'm just going to stay if that's all right. And that's how this thing started. What we had to do was not beg for a place at the table or beg for an opportunity or beg for resources. We, with partners, went into the legislature in 2014 and passed the House Bill 1355, which mandated the Department of Corrections allocate certain funds to community-based organizations doing this work. We felt like we were resource rescuers in a way, because the budget for corrections in Colorado is $1 billion, and you're satisfied to continue with the process of 50% failure. That's not speaking to the failure of people coming out of prison. That's speaking to a systemic failure. And so our approach to this was, one, to get the door cracked, and then to do what we could to remove it from its hinges. This has been our process. You know, there was a time when I was sitting in the penitentiary, and I was sitting on the highest vantage point in this yard because that's how I lived inside. And I remember a young Black man coming to me. He was about 20 years old, and he asked me if I had a minute, you know, and he seemed serious. So I said, yeah, what's up? He said, I'm getting out of prison next week, man. What do I need to do to stay out of prison? When he was asking me this, I was thinking, why are you asking me? I can't even get out. But what I did, I started asking him questions. And I said, well, were you in the life when you were out there? He said, yeah. I said, well, you probably want to think about, you know, getting a job, you know, trying it that way. I said, were you hanging out all hours of the night? He said, that was my shift. I said, well, you know what it's like when the sun goes down. You know, maybe you should think about coming in at an early hour. I said, were you getting your freak on? He said, you know it. I said, well, maybe you could consider trying to find someone that you could build something with, like a life with, you know. Whatever he said, I said the opposite. When he walked away from me, I was thinking, damn, Hassan, that's some wisdom. No play on your name, brother. I said, if you ever get your Black ass out of prison, you better do the same thing. And so basically my work is trying to hold true to that. I don't want people to have to go through the experiences that I went through in order to have dots connected and lights come on. And for me, it was a process of coming to grips with understanding that, yes, they may have got this wrong, and this wrong, but they got the right guy. You were running amok and you wouldn't have stopped on your own. So we try to focus in our work people's attention on self and what their responsibility for in their life situation, regardless of all these systemic things. Not to say that we're not going to look to address those, but even regardless of that, you know, prior to us in this space, people in generations of our Black and Latino and other folks of color have gone through these systems and struggled and found a way to navigate them. You know, it's not like in a Black family, everybody goes to the penitentiary, you know, but I think we're set up along that course for many ways. And when it comes to health, we have a saying at Second Chance Center that successful transition is a matter of community health. And so when we think of it that way, we're thinking about health as an overall blanket for society. And if any part of it is still ill, it's kind of unrealistic to expect the body to be healthy. And so I think that's what we're all involved with. You know, I had an older gentleman. When I say old, I'll be 65 in 2 weeks. So this guy had to be dusty, right? And he asked me, how could myself, Sean Ashi Taylor, who's the first person I hired, caught a life sentence at 17 and did 22 years in Colorado until Governor Ritter commuted his sentence. And Adam Abdullah, who did 33 years and 3 months in the federal system. So you can imagine with the three of us, 75 cumulative years, when we started doing this work, people were wondering, what are these guys up to? And understandably so. But this gentleman asked me, how could we do so much time and come out of prison with all of our marbles? Now, I didn't want to debate the assumption that we had all of our marbles. I just took that as a compliment and responded in the way that I still believe. And that's that the only reason we were blessed to return to this world is to do exactly what we're doing. And so that's why I'm doing this work.
Thank you. Thank you very much. Listen, I want to take us from where we are today in COVID, in racial justice movement, where we are today. What do you all think needs to happen to move things forward in the short term, in the midterm, in the long term? Your vision. What do we need to do and to move things forward. If we could just get a quick sort of understanding of, I know you've been thinking about this, right? You're already implementing solutions. What else needs to start happening for things to move in the right direction? Wisdom.
For us, I think of it in terms of if you're tracking the news of a company like SpaceX and all the innovation they're bringing to aerospace, you don't get to the SpaceX of education through a series of $50,000 grants every other year. You're not going to get to that level of innovation if we keep investing. Sometimes it's a mix of concert. We're not even going to get into how Black entrepreneurs, I'm not even going to open that up, because I feel like everyone should be well aware that if there's any kind of stat, chances are it's not equitable for Black folks. But for us to actually build Wakanda and Aurora, yeah, I'm working with my executive coach on owning, you know what, no. By 2050, collectively, since SpaceX started, we're talking about $50 billion. And I'm not saying, you know, we're in the same industry, but I'm saying that level of investment into our community is required. And until we live in a capitalist system and we require money to move. And for me, when I study the history of this country, that's in fact the only two things that have shifted things radically are money and blood. And I'm not interested in dying for this country. So for now, we're trying to do this through this public institution. And I honestly try not to make my answer more complicated than that. Because when you talk to our students, when you talk to my staff, you're not gonna sense any hesitation about what we're trying to do. Right. I'm not unclear about what I'm trying to do. I lack the resources to get there. And when I text my friend who works at a private school, actually Kent, Denver, one of the with the highest tuition I think in the state, and she describes to me the cafeteria, I think, yeah, stop pretending we don't know the solution to this problem. And a major one is proper investment. That's
yes.
just
yes, yeah. Thank you. How about Sade? Your thinking on what needs to happen.
Yeah, you know, just looking at where we're at, CHIC has really transformed and started to look at who the people are, who holds the power, what programs are out there, and what does policy look like. And for example, for us, we're doing a landscape analysis from foundations to community members and to those who are supposed to be receiving resources. How are foundations making sure that it's equitable practices so that us as people of color can really help out our communities of color? Secondly, we created a COVID community response distribution where we were able to raise $77,000 in 45 days to put back cash into communities of color's hands from Denver to Aurora. And we were able to do that. And the reason why we had to do that because our government at that time was in a pansy trying to figure out when do stimulus checks come out or not. And people needed essential items, right? I get food, we get other things, but our people needed essential items, and nobody was doing anything to put a $50 or $100 gift card in their hands. And so that showed us a gap of how do we as communities mobilize in the event of 24 hours to help out our communities. And guess what? There's nobody out there that is doing that. And so I encourage even foundations, right? If we are really about assisting communities, how are we supporting those organizations who can do that if we are on the ground level? And so now we're looking for an organization to hold our community fund.
Yeah.
Thirdly, we are working on, I talked about earlier, we don't need a handout. We need some hand ups. right? And where we're at. CHIC is wanting to push free lifetime education for BIPOC people and preschool in the state of Colorado. It can be done. So put your march where your money is. Your money where your march is, right? And so when you start to think about how are we creating opportunities, and we've been talking about reparations, and we know that we're not going to get the reparations, let's do something, people. So if you want to take an investment on us, invest there. Every Black person, if you want to move things economically for Black people, if I can go to school or get entrepreneurship training equivalent to a degree, or get trades training equivalent to a degree, or get my preschool paid for my children, that move will be monumental for African Americans and Black people in the state of Colorado. So if you're talking about shifting the pendulum and creating change, think there. And lastly, we talk about programs. CHIC is very specific about integrating in places where they say women cannot be. So if we can't work in your program, we will create it. So Colorado CHIC will be the first pre-apprenticeship training program for women of color in the state of Colorado. Because they say women don't belong in construction. We do. They say women of color don't belong in construction. We do. And we're all about creating access, exposure, and opportunity. So I'm about change. And I know there's a question in the chat that I know that you're going to come to, and it talks about the Elijah Plain and the marching, and to its understanding where we are fighting at. I fight behind the scenes for the bigger cause. I can't be marching out there right now because I need free education to happen for every Black person in the state of Colorado.
Yeah.
Right.
Lifetime. That is the change I need. So I'm sorry, I'm passionate because this is my community.
Yeah.
Everybody has talked about, and wisdom, I teared up when wisdom spoke, and I have to say it, I teared up because he said the first thing that he was born as was as wisdom. That's the first thing anybody ever known him as, was as wisdom. And he comes to America and he's known as a Black man first. That's the problem. That's the problem. I have 3 kids. That's the problem. But thank you.
No, thank you, Sade. That was well said. Thank you. Let me go to Deidre, because I know Deidre has a little bit of a time constraint with us, but so I want to make sure that we get yours in. What do you think needs to happen next? And you've talked a little bit about this already in terms of the work that you're doing with HICPUF and the work that you're doing with Robert Wood Johnson.
You know, I think short-term, mid-term, long-term, short-term, really just doing all we can to meet the needs of people.
Mm-hmm.
We, like Sade mentioned, did the same thing, making sure we got funds out to folks in May. And what fascinated me was some of my navigators were saying, you know what, no one's doing this. And I thought that it had to be impossible. But the problem is the framework. Public agencies do it, but they wait till you're on your knees, about to be evicted, on the verge of disaster. We were just doing it, you know, to make sure that that didn't happen to people. So paying rent for a mother who just lost her job, had 7 kids at home, and did as much as we could. And people are going to need more of this because this pandemic's not going away anytime soon. I'm very worried about the evictions that are about to happen, even though they've been happening to us. Midterm, you know, the work I was talking about with, we're partnering with HICPUF, we're partnering with others. What can we do to improve these systems that for now we're stuck with? Because here's the thing about the safety net. The safety net ideally should just be a place that you have a moment, it boosts you up and keeps you going. We don't have that. We have a strangle net. You get stuck in that safety net, you may be there for generations. And which speaks, you know, to the long term. One of the things that happened for us during COVID is, you know, we had planned to slowly grow our mental health supports and slowly grow our policy, that we changed our prioritization. We're growing mental health just to help our community function during these times. But my plan of only partnering with advocacy organizations changed. So I'm on a mission that we have our own public policy staff before the next session because we need to be leading on some things. And I've been very clear that although they might be employed by the Center for African American Health, they're at the disposal of everybody on this panel, the NAACP, because we're going to come together with a shared agenda on what we should be going for and working with our legislators on. And ultimately, just, you know, the honesty. This is a racist country. We need to dismantle these systems. And, you know, when I think about how I was raised, my sister and I had fabulous opportunities. But I think of as Hassan was saying, what you're grown up with. My father was extraordinary, but his view of the world and raising us as, you know what, you're born behind enemy lines, take care of yourself, strategize, this is how you do it. He came to that because in 1954, my uncle was murdered by his white coworkers. And my father was a senior in high school and lost his closest brother and his idol. And so when you think about the mental health aspects of that, when they, you know, small town New Jersey, people know who did it because that person suddenly disappeared and no one ever paid. And, you know, in 2014, when he was going through the dementia, that's the one thing, that lack of justice, that he would cry about in his last days. And so I look at this as a continuum. You know, like you said, we're a part of families. One of the things we didn't get a chance to talk about is that preschool to prison pipeline, because I'm raising young boys. You know, I now have a 16-year-old who's 6'4" and going to be a junior. We went from St. Mary's Academy, where they were the only ones, because my sister and I had gone there, so I trusted it from the standpoint, okay, I can be that advocate for them with ease, to, and I've been very public about this, and I'm pleased at the changes they've made, the DSST charter school, where my children will say, that is where they learned about racism. And it wasn't until I learned what was happening to them that I kind of went to my own ward, demanded their data, showed that, yes, you're diverse, but all of the discipline is these Black and brown boys. Why is this happening? And so now they've got someone who's working on equity, they're doing the trainings and things, but we shouldn't have children suffering to get change made. One last thing, we're in Denver, where, you know, we've got a lot of momentum going on. We have other parts of the state where people are clamoring for assistance. And so I always try to mentor folks when I get a chance. And I met a mom a couple of years ago, and now I'm helping her nonprofit grow, and the center is going to be partnering with her. But when I first met this woman, she was outreaching for me. She lives in Larimer County. She's African American. Her 16-year-old son was arrested and jailed for 2 years. It might have been 1 year. Either way, it was horrific. All he had done was take a video of a school fight. He wasn't even in the fight. The kids who were in the fight, but he was the one Black child in this crowd. And, you know, he's out now, but think about what that's done to his young life. He didn't do anything. And, you know, we've got preschoolers being kicked out of school just because we don't developmentally give our children the same latitude as others. So I'm spiraling, because it's all integrated. And so I appreciate everybody in this panel. I think, you know, we have to keep leaning forward. At the beginning of this COVID, you know, we were trying to do as much as possible. And I lost three male cousins on the East Coast in 1 week. And for about a week, I probably still haven't grieved, but for about a week, it was surreal. And it's not going to end anytime soon, but the thing that keeps bringing me back is this life, my family's life, this work, our community life. It's so important because I want my teens who are out in the world to have chances that none of us have ever had, just to live as free people.
Thank you, Deidre. Hassan, we're going to go to you, and then we're going to go take questions from the audience, because I see them putting in their questions and they're ready. And
well,
so
I'll try to be quick. I wish I was able to look at the audience. I want to start by telling my sister Sade to never be apologetic about your passion. I mean, this is our fuel. And, you know, those who are watching, you know, you can see this is an emotional discussion for all of us, you know. So let me just ask what we need to be doing. First, we need to be voting, okay? That's the most immediate thing. I'm gonna just stop right there. We're involved at Second Chance Center with doing legislative things to change the landscape of sentencing and all of this. we have been involved in the passing of 12 pieces of criminal justice reform legislation here in Colorado. 9 pieces were signed into law by Governor Polis at our site last year. We are very proud of that acknowledgement. But so that's what we're doing about that. One I would like to see is profit removed from the criminal legal system. I mean, we started out with convict leasing in Jim Crow time, and now we're at a place where the same people who own private prisons own halfway houses and community corrections, own BA and UA companies, own monitoring ankle-based companies. So for us to think that those people who are in that industry are looking for some sort of change in the process, it's not realistic. I mean, take a nonprofit, Second Chance, for instance. We have to be successful. Our people have to succeed for us to survive. That industry is profitable based on people struggling and failing and going in and out of the system. So we need to remove for-profit from justice in America, and that's a big move, and we're up to being a part of taking that on. Secondly, I think Black people in particular, we have to kind of remove the chains from our own thinking, the kind of thing that limits us to those things we think are possible. You know, for instance, we had a big issue around housing and affordable housing and access to housing for our folks. And we did everything we could to try to address that. And we're missing the mark in very significant ways. And we decided that we were going to build our own complex. And we broke ground last year, and we opened up a 50-unit permanent supportive housing project right behind Empowerment Community High School. Okay, so this was the kind of thing that I was told we couldn't do a LIHTC project. Nobody gets a LIHTC project funded on the first try, and my population is not really a basket of puppies, and difficulties of of being able to put a complex for folks who were recently released from incarceration, chronically homeless folks, people with disabilities, mental, physical, or emotional, like no neighborhood. People understand the need for that. They just don't want it in their neighborhood. So we dealt with that kind of thing in the city of Aurora. And we got past that because a lot of things that we've been able to do through the Life of Second Chance Center have been first, to be quite honest. One of the bills that passed last year returned voting rights to over 11,000 people currently on parole in Colorado. And this is so significant. People need to understand that some elections are turned by less than a dozen votes. You know, in particular, district attorney positions, which is an elected position, one of the most powerful in any state legislature. So we're going to be involved in getting people to know who their DAs are, and getting that address. So we're talking about engagement and involvement, and I think that's what needs to be done with vigor and with enthusiasm and with passion and everything that we have in abundance. One thing, just really quickly, this COVID thing that everybody's experiencing, I'm a hope fiend. I still am a dope fiend. I just don't use, but I'm a hope fiend. And my hope is that this shared experience of this pandemic, because we got people in America now who aren't used to being uncomfortable. So we have people now that are dealing with isolation, dealing with separation, dealing with dealing with fear and anxiety related to where the next meal is coming from or how their rent is going to get paid. Well, this has been Black folks' lives forever. You know, and my population coming in and out of incarceration, this is something that we know, it's ingrained in our DNA. And so I'm hoping that people experiencing this kind of thing, maybe for the first time, that will fuel the continuation of open conversations about what we need to be doing collectively. So.
Thank you, Hassan. And thank you all for that. You were clear. Thank you. We want to go to the audience because there are some questions in the chat. Sarah, you want to handle those?
Sure. Thanks to everybody who submitted questions in the chat, and thanks to our panelists. We may not have time to get to all the questions today, so we'll be happy to follow up offline with folks as well if there are questions that continue to come in that we are not able to get to. So I'm going to try to combine 2 questions for the interest of time. So we had a question related to this sort of metaphor of racism as a pandemic, and furthering that metaphor, the idea of the mutations of racism and how it continues to evolve over time, and how you see your organization and the community adapting to those unfortunately ever-changing obstacles that will continue to exist. And then the sort of second part of that question, and you guys can choose which ones to address, is how do we as partners help address the systemic changes so that we achieve a more just society, thinking at the macro level. Thanks.
Can I say a couple things? Because I'm gonna have to run to another panel.
Please.
You know, racism is something that's kind of our reality, but we did not build this system. So we can't dismantle it. And even as we tinker around the edges, which we're really doing when we try to change these policies, to really uproot it, takes those folks who don't see it, because some don't, to understand it so they can do their part. And the best messenger, I believe, is those that look like them. And so that's what I tell some of my friends. I have one very close white girlfriend, and she was in a situation. I said, but you know what? You're the best person, you're the best messenger. Me talking to this person is just gonna be, oh, here's another Black person complaining about blah, blah, blah.
Whining.
Tell them what you see and they'll hear you. And then later on, circling back, A, she felt empowered, and B, I think she felt like she was making progress. Because at the end of the day, I'm astonished at how many people don't know people who don't look like them, but you can actually live your life doing that. And that's not, you know, depending on your life journey, I'm not saying it's good or bad, but the weight on dismantling a system we did not build, I don't own. It's kind of like you give a kid, someone said you give a kid, some people get toys that are already put together. Some people get toys that are assembled or that you need to assemble. We have been given toys that you need to assemble with pieces missing, so we can never do that. So we can't solve that. And it's just a metaphor from another conversation I had, that I'm ardent. I can't over communicate how important it is for folks who are allies and want to be allies. The first step is just talking to your circle of influence and have them really drop their assumptions and start thinking about things differently. And I want to thank you all. This has been a wonderful conversation. I could do this for hours, and I will definitely be in touch. I'm on my way to a health equity panel.
Thank you so much, sis.
Thanks, Deidre. Thanks for joining us. Sade, do you want to go next?
Yeah, I'm just gonna follow honestly along the lines of Deidre, and one is using your voice and your resources. I think that's how we really start to change, to shift, and to shift the narrative. Like, as Deidre stated, racism will always be here. It's unfortunate. It's about how we have to navigate through it at this point of time. But the recommendation I'm going to say is you're using your voice and your resources.
Yeah.
Thank you. Hassan, do you want to go next?
Yeah, just real quickly, the part of our work at Second Chance Center is about cognitive restructuring, like I spoke about, and that's often very uncomfortable for all of us involved, because it's asking people to look at sometimes very dark and deeply disturbing things about self, and trusting that you're involved with people who are going to help you dig through that and get past it, if that's even possible. Well, I think part of that, when we speak about allies, is our allies who are not people of color have to be okay with being uncomfortable about the fact that whether or not they were involved direct with one thing or another, that just by the nature of being born white in America, that they have benefited from these systems and continue to. And not to slap any foundations, but a lot of the foundations that I know now that are doing philanthropic work need to be honest about the origins of that wealth, you know, and where it actually came from, and to be okay with acknowledging that, because when we start talking about the racism just changing its veneer, it's a big job, and it's going to require a lot of honesty and introspection and a lot of discomfort, and people have to find a way to be good with that.
Thanks. Wisdom?
Hearing that last statement from Hassan has me thinking about truth. And I forget where I heard this quote, that with racial progress comes racist progress. Like me personally, as a Black, I always separate me just as a Black person in this country. Post George Floyd, I've mentally given up on. I don't have hope for the country. I have hope for its children, which is why I do the work that I do. And I just think, so then what gives me hope then that, you know, as the racist systems mutate, so will this young generation. And it's, if we have systems that are truly, this one quote captures it, which is, love without truth is hypocrisy, and truth without love is brutality. And what we constantly existed in this country is a state of hypocrisy and brutality. And if folks, individuals and their institutions can look within and constantly face the stark truth of the situation, I'll have hope. If they continue to engage, let me not go down that path. Let's end on that positive note.
Yeah. One more question, and then we'll turn it back to Benny to wrap up. If you could talk about the way in which the protests in our community, including the Elijah McClain protests, have affected your work or your community, and how you feel about what it means for the work going forward. Love to hear from you on that. Wisdom, you want to start this one?
Yeah. I think there's a lot more to the question, so I'm trying to focus on, because to me, any kind of civic engagement is good. Folks exist in such a tranquilized, docile state that I don't give, not going to curse in front of all of you, any kind of civic engagement is good civic engagement, especially from my community. And when you look at anyone who has an actual understanding of violence, the violence of one of the mothers who doesn't have enough money right now to buy an inhaler for her child, that's the kind of violence where when you face that every day of your work, you don't look at things like the Elijah McClain protest as any kind of violence. That's not violence. That's people enraged and trying to have their voices heard. My little brother was at one of those protests, and I was proud of him. And I also had to say, hey, Godwin, just so you know, this is not where the work ends nor begins. In fact, the reason I don't show up to the protest is because I went through that phase, and I saw how literally 6 years ago, some of these pictures are the exact same. They're just in a different location. And I see how these cycles just never actually get disrupted. So ultimately, for me, any kind of civic engagement is good civic engagement. Two, internally at Empower, we think of it as, all right, how do we give our students the tools for them to process what's happening and think for themselves, think and decide for themselves. So for us, that's why we have that framework. I'm not gonna go into all that right now, but we have a framework we use that helps them break down all these actions they're seeing and identifying what is actually transformative, what is conformist, what is self-defeating, what is reactionary. That's what I mean when I say school has failed all of you. Because I really doubt in Cherry Creek that some of those students are being equipped to actually break down both the ways in which you all will get me heated before I have to go back to class. Let me slow down. I'll leave you with this sentence, which is any civic engagement is good civic engagement. For us, it's been very helpful because it's informed what the curriculum will look like this fall. And if there are schools that are not shifting their curriculum to address this, that's a very problem of education, because our kids are hungry for help actually understanding what is going on and how they can participate in improving the outcomes. And for us, we're trying to say, we need to link up with folks like Hassan. We need to link up with folks who are really trying to shift policies. And actually that counts as your schoolwork. Yeah, so how do I get you, let's set up an independent study. And how do I actually get you course credit for that kind of civic engagement? How does that count towards your graduation requirement? And for me, honestly, that's the kind of question I'm interested in answering. Yeah.
Thank you, appreciate that. Sade or Hassan, do either of you want to address this as well? Sade, I know you already touched on it a little bit.
May I jump into this? It's impacted me two ways. I had people reaching out to me very early on after the murder of George Floyd and wanting me to come and speak with some places or do some interviews. And I was resistant, and I declined on all of those offers because I was really in a place of renewed despair, to be honest with you, because I was born the year George Floyd was murdered. And I've been watching this happen every year of my black ass life. And I don't have a problem dropping a couple bombs when I'm talking with them. So excuse me if it's offensive to anyone. So I was really at that. I didn't know what to say or what to offer. It was like worn out. But what I got out of the next couple of weeks of watching primarily young folks, Black and Latino and Native American and white young folks hit those streets with that kind of energy and that kind of passion, you know, it renewed something for me as well. And it also made it easier for us to drive through a piece of legislation that deals with law enforcement accountability here in Colorado. We were one of the first states to eliminate qualified immunity, where police officers cannot continue to brutalize the citizenry and not be held accountable. And I don't believe that we could have gotten that bill passed as quickly as we did with the bipartisan support that we did if there were not all kinds of noise and energy right outside the windows of the Capitol. So I thank all of those that had the energy and the passion to get out there. And I just pray for their safety as they continue, and they need to continue. That's my feeling about it.
Thank you. Thank you. We are almost out of time, and we have a couple more things that we want to make sure that we share with you. But from the bottom of our entire Rose Community Foundation family, we want to thank you for this very honest and thoughtful conversation and dialogue. And we want to say, we believe in you. Keep pushing and rest, and lean on us when you need to rest, because that's really, really critical to keep moving forward. But we are so honored to be in partnership in some way with you, and lean on us for thought partnership, and for a walk. I mean, whatever it is that you need to feel the support of the Rose Community Foundation family, I want you to know that you have it. So then I'm gonna now turn it over to my colleagues who are gonna share some other things with you.
Well, thank you for that invitation, sis.
Thank you, Benny, and thank you again to all of the panelists. We are in the midst of a year of extraordinary challenges and hopefully also some significant new opportunities. Nonprofit leaders like the panelists we heard from today are being asked to do more than ever, and they have risen to the occasion. As you have heard, they keep rising. At Rose Community Foundation, we have the great honor of working at the intersection of two key stakeholder groups: committed nonprofit leaders like Hassan and Deidre and Wisdom and Sade, and generous people interested in using their resources to help support our community. One of the most important roles we can play as a community foundation is making connections between these two groups, and especially connecting donors to nonprofits that may not have been on their radar because they're smaller or newer or simply outside of a donor's existing network. There are many fund holders on the call today, and I just want to say we have been so moved by the extent to which you are responding to the demands of this moment through your giving. So far in 2020, donor advised fund holders at Rose Community Foundation have granted $2.8 million, including a rapid and significant increase in grant making in the early second quarter, when funds granted were 300 times what is typical for that time of year. This increased giving is not unique to Rose Community Foundation. It's happening across the community and across the country, and we hope it will continue because it's part of what is needed to help us move out of crisis and into a stronger and more just future. So for anyone who is in a financial position to give at this moment in time, we hope you will join us in answering that call, and you can do that in a couple of ways. First, we stand behind our grantees and encourage you to join us in supporting their work. You can support the organizations and leaders you heard from today directly. You can also find a complete list of all the foundation's current grantees on our website. We encourage you to check that out. Secondly, if Rose Community Foundation's approaches to advancing racial justice or funding COVID-19 response efforts in our community resonate for you, we would love to have you as partners in this work through our Community Action Fund for Racial Justice or our COVID-19 Respond Fund. Both of these funds are ways to leverage your charitable giving with the foundation's resources and relationships to be part of a larger philanthropic response. We believe that growing the culture of philanthropy in our community is essential to building a more just, equitable, and inclusive society. The bottom line is the needs in our community outpace the resources devoted to addressing them. This was true before 2020. It's true on a whole new level now. So together, we need to grow the resources available and encourage a more equitable distribution of that philanthropic pie. For those on the call interested in advising or support regarding your philanthropy, or if you want to be connected directly to any of our panelists, reach out to me or to anyone on our team. And I just will close with thanks. Huge thanks to our panelists for your time and perspective, and even more for the work you do. Thank you to our staff on the call and those working behind the scenes to make the call happen. And thank you to everyone for joining us today. Thank you for your generosity in this moment, whatever form that generosity takes, your time, your leadership, your voice, your resources, all of the above. Thank you and take care.